My name is Tiana Moore, and I'm the Policy Director at the UCSF Benioff Homelessness and Housing Initiative. BHHI is a research and policy center based at UCSF devoted to generating evidence-based solutions to prevent and end homelessness. You can learn more about us on our website. This morning, we released a report about Black Californians' experiences of homelessness from the California Statewide Study of People Experiencing Homelessness, or CASPEH. In today's webinar, we will discuss our findings, highlight key policy recommendations, and answer audience questions. Before beginning, we want to let you know that this presentation contains discussion of physical and sexual violence, suicide, and discrimination. Please put your self-care first as we move through today's webinar. Our panelists today are Joy Moses, who is the Vice President of Research and Evidence at the National Alliance to End Homelessness and a member of the CASPEH Policy and Practice Advisory Board. For over 15 years, she has worked to reduce poverty and advance racial justice. Dr. Kara Young-Ponder is the Director of Community Engagement and Racial Justice at BHHI and the lead author of the report on Black Californians' experiences of homelessness. At BHHI, she leads community partnerships and analyses of race and racism. Robynne Rose-Haymer was a member of the CASPEH Lived Expertise Advisory Board. She currently works as a vice president at Capital Impact in Sacramento. Robynne began her career as an on-the-ground practitioner, working directly with low-income families and communities of color on health, well-being, and education issues. She's currently pursuing a doctorate in education at the University of San Francisco. And finally, Sage Johnson was the Southern California co-chair for the CASPEH Lived Expertise Advisory Board. Sage's work and passion is centered on tackling homelessness for transition-age youth in Los Angeles County, particularly Black and queer young adults. We'll now have Joy Moses begin with some opening remarks.
Good afternoon, and thank you for inviting me to be a part of this very important conversation. Being based in Washington, D.C., I'm regularly a part of circles that crunch data to produce talking points on homelessness. A lot of reliance is placed on federal government reporting, and indeed, HUD's annual reports offer highly relevant snapshots of various factors related to homelessness and racial disparities. Thus, I'm able to cite such data points as the point-in-time count indicates that 54 out of every 10,000 Black people are homeless on a single night. And this is compared to 20 out of every 10,000 people in the overall population. And we also know things like Black people have the largest representation within sheltered homelessness at 38.6%. It should be obvious that far too much is missing from such numbers. They offer no information about individual people impacted by the ongoing crisis, and many questions are left unanswered. That's why Benioff's research and the findings being discussed today are so important. The California statewide study was able to delve more deeply into some significant foundational questions related to how and why people became homeless and what it would take to permanently rehouse them. Qualitative work offering nuances of people's realities elevates everyone's understanding of the issues. Realistically, however, the full story of Black homelessness involves more layers that can be captured via surveys and interviews with current California residents. The full story is one rooted in massively weighted issues such as slavery, Jim Crow, ongoing institutional racism, caste, redlining, mass incarceration, and of course, a nation that has never fully committed to remedying its past wrongs and current wrongs. Paired with the realities of this larger context, Benioff's research has the power to point policymakers in the direction of real solutions that can reduce disparities for Black people in California, while also informing efforts to study and reduce homelessness for all people and communities across the country. Thus, I have been looking forward to today's conversation, and I'm just so thankful to be joined by these lovely panelists. So I'm going to step away and really listen in and pass the floor over to Kara.
Thank you, Joy, for those thoughtful and inspiring opening remarks. and thank you all for being here with us today. I'm Kara Young-Ponder, and I'll start off by telling you a little bit about the origins of the CASPEH. The CASPEH is the largest representative study of homelessness in the US since the 1990s. Dr. Margot Kuchel is the principal investigator. The CASPEH was conducted at the request of the California Health and Human Services Agency to answer critical questions about homelessness facing California policymakers, and it was funded by the UCSF Benioff Homelessness and Housing Initiative, Blue Shield of California Foundation, and California Healthcare Foundation. CASPEH was conducted in 8 counties representing 8 regions. It included adults over 18 experiencing homelessness and resulted in 3,200 questionnaires paired with 365 in-depth interviews. Importantly, this work involved community-engaged practices, including 3 community advisory boards. Within CASPEH, the work we will share today aims to analyze the experiences of Black Californians experiencing homelessness using qualitative and quantitative methods. To understand the specific experiences of homelessness for Black Californians, we recruited participants who identified as Black for a qualitative sub-study focused on the Black experience. We focused the interviews on participants' experiences of anti-Black racism, how anti-Black racism impacts their journey into homelessness and access to housing and other services, and what strategies they develop to navigate homelessness and housing. We constructed the interview guide collaboratively with a subcommittee of BHHI faculty and staff and people with lived experience of homelessness who identify as Black, and the interviewers for this sub-study in the field all identified as Black as well. 50 of these interviews focus specifically on Black Californians. However, in our qualitative analysis, we include all interviews conducted with Black Californians across 7 sub-studies, which lead to 122 included interviews. We cannot understand the experiences of Black Californians during homelessness without first examining the history of anti-Black racism in the United States, as Joy mentioned. Anti-Black racism is a term to describe a set of beliefs, ideologies, and practices, both individual and institutional, based on the idea that those with Black skin are inherently inferior to those with white or brown skin. It is a system held in place by anti-Black policies, institutions, and ideologies that systematically marginalizes Black people. The overrepresentation of Black communities in the homeless population arises from 400 years of anti-Black racism entrenched in the structures, institutions, ideologies, and social norms of American life, starting with slavery. Slavery was an emotional, spiritual, and physical state of homelessness for enslaved Africans. Although slavery ended in 1865, the terror of white supremacy did not. The system of Jim Crow segregation, a set of legal and social codes that dictated the complete separation of Black and white people, emerged to keep the Southern economy almost entirely the same as before emancipation. The result was the systemic creation of a class of Black people who were disenfranchised, uneducated, poor, and propertyless. At the turn of the 20th century, large numbers of Black migrants fled racial terror in the South for the North and the West, where they confronted a different type of hostile landscape. As Black families attempted to move into white neighborhoods, white communities reacted through violence and forced residential confinement of Black households into Black enclaves in a system that would soon be codified into law as redlining. A dual housing market was created. Black communities were confined to deteriorating properties in the center of the city, and white families received assistance to move into newly built suburbs. In many cities, neighborhoods today are segregated along the same lines drawn in the 1930s. Today, as a direct result of this segregated housing market created in the 1930s, the wealth and home ownership gap between Black and white families is wide and widening. Today, anti-Black racism still runs through every system in our country, including the education, carceral, and employment systems. The trauma caused by living in a racist society can increase the risk that Black individuals experience individual challenges that leave them at a higher risk of homelessness. However, Black Americans live with the consequences of anti-Black racism in all aspects of their life, which increases their risk of homelessness, even absent other vulnerabilities. With this context in mind, we turn now to a discussion of who in the Black community experiences homelessness. The proportion of Californians experiencing homelessness who are Black is 26%, according to the CASPEH. This reflects a dramatic overrepresentation of Black Californians who make up only 7% of the population of California. 3/4 of Black Californians experiencing homelessness identify as cisgender men, compared to 64% of white and 68% of non-Black, non-white Californians experiencing homelessness. Black men are at particularly high risk of homelessness via the prison to homelessness, unemployment to homelessness, and school to homelessness pipelines. They are punished more harshly in schools, have a harder time bypassing racial discrimination and hiring practices to find steady work, are more likely to be the targets of police surveillance and enter into the carceral system, and more likely to face racial discrimination when attempting to find and stay in housing. Of Black Californians experiencing homelessness, 90% were single adults, 6% were adults in families, adults living with minor children, and 4% were transition-age young adults, 18 to 24-year-olds not living with a minor child. Despite the fact that only 6% of participants were considered adults in families, 27% of Black single adults in TAY experiencing homelessness had minor children. And among those who had any children, 79% had children who were not currently living with them. An adult may not have custody of their minor children for several reasons. They may never have had a custodial parent responsibility. Child Protective Services, or CPS, may have forcibly removed their child. In in-depth interviews, we learned that some Black parents facing the threat of homelessness or intervention by CPS relinquished custody of their child voluntarily to friends or family. The homeless population is aging. The median age for Black Californians experiencing homelessness was 50 years. Over half, 51% of Black single adults experiencing homelessness were 50 years or older. 36% of those 50 or older first became homeless after 50. Black Californians were more likely than those of other racial groups to report recurrent episodes of homelessness. 71% of Black Californians experiencing homelessness compared to 62% of white and 54% of non-Black, non-white Californians. Black single adults and TAY were more likely to report recurrent episodes of homelessness than Black adults and families. We also asked participants to share with us whether they were experiencing chronic homelessness. Chronic homelessness is defined as both experiences of homelessness for at least 12 months, or having 4 or more episodes of homelessness in the prior 3 years that together total more than 12 months, or having a disabling condition. According to these guidelines, 32% of Black Californians experienced chronic homelessness. Black individuals had a higher prevalence of severe mental health symptoms and problems. They had a higher prevalence of hallucinations, of suicide attempts, and of mental health hospitalizations than white and non-Black, non-white Californians experiencing homelessness. The high prevalence of severe mental health symptoms reflect the overlapping experiences of trauma that Black participants have gone through in their lives, the unrelenting everyday experiences of anti-Black racism they experience in institutions and social interactions, and the lack of support structures during crises. Black Californians were more likely to have a history of incarceration in prison than other racial groups. While Black Californians had similarly high likelihoods of incarceration in jail at some point in their lives compared to those of other racial groups, they were more likely to report a prison stay. 43% of Black Californians experiencing homelessness reported a prison stay in their lifetime, compared to 31% of white and 37% of those from other racial groups. Jail stays are ubiquitous in people experiencing homelessness, partly because of the criminalization of homelessness. Spending time in state or federal prison is a major risk factor for future homelessness because of the impact of criminal justice records on every aspect of life, education opportunities, employment, and housing. Decades of research have shown that the higher rates of incarceration for Black people in this country is not because Black people commit more crimes, but because they are surveilled more harshly and more frequently by police. Black people are arrested more often and sentenced for longer periods than non-Black people. Black individuals reported a lower lifetime prevalence of regular substance use than those from other racial groups experiencing homelessness. About half, 58%, reported using illicit drugs regularly at some point in their life. Conversely, 74% of white and 65% of those from other racial groups did. And 58% of Black Californians reported heavy episodic alcohol use at some point in their lifetime. And now I'll pass it over to my colleague, Robynne Rose-Haymer, who's going to talk about pathways to homelessness for Black Californians.
About the last place they lived prior to homelessness, 46% entered from non-leaseholding arrangements, living with family or friends or in other informal arrangements without the legal protections of a lease agreement. 33% were leaseholders in their last housing arrangement. And more than 1 in 5, or 22% of Black Californians experiencing homelessness entered homelessness directly from an institutional setting, primarily from carceral settings. High housing costs and low incomes increased risk of experiencing homelessness. In the 6 months prior to homelessness, Black Californians reported a median monthly household income of just $1,000. Among non-leaseholding Black Californians, the median monthly household income was $960. A large proportion of non-leaseholders did not contribute financially in their last housing, but among those who did, $400 was the median monthly housing cost reported. This share of cost is an amount that is both unsustainable when only making $960 a month and hard to replicate once that housing is lost. The median monthly household income prior to homelessness for leaseholding Black Californians was $1,200. Leaseholding Black Californians reported a median housing cost of $675 prior to homelessness. Therefore, leaseholders expended more than half of their limited income on housing. Economic precarity undergirds homelessness. During in-depth interviews, Black participants discussed work and employment changes, such as hours being cut from their work schedules, as reasons for leaving their last housing. Considering the aforementioned severe housing cost burden, this fluctuation can be enough to tip people into homelessness. Black participants discussed how health, both their own and that of others in their social network, increased the precarity of their last housing arrangement. Health problems can interfere with their ability to work, making it difficult to keep up with housing costs. The COVID-19 pandemic created additional risks for low-paid frontline workers. As one Black participant shared,
that's kind of making it bad for me because I really can't do too much. They have me as disabled because of my back and my leg, so I really can't do all the things I used to do. I got hurt at work just before COVID, and when COVID came, it just messed everything up. So that's why I became homeless.
almost a third of Black Californians who were non-leaseholders in their last housing reported that interpersonal reasons, such as not wanting to impose on others at 17%, or conflict between residents, 13%, was why they left their last housing. Through in-depth interviews, it was clear that underlying the interpersonal reasons was economic distress. Participants reported that due to economic precarity, they had been forced to double up and live in crowded, under-resourced environments. Black participants described how these arrangements created tension or conflict, resulting in the breakdown of the relationship and eventual homelessness. Structural factors contributed to housing loss for Black Californians as well. Those with criminal justice and system involvement discussed ways in which their records made it difficult to obtain housing once they exited from jail or prison. Few received support finding housing upon reentry. For some Black participants, anti-Black discrimination disrupted their housing stability. In the interviews, some Black participants discussed how discrimination caused them to leave their housing. They left housing either to maintain personal safety or due to unfair treatment by those with authority at their last housing, such as property owners or building staff.
Yeah, one of the roommates was very racist, and he had been basically attacking me and messing with me, and they gave him permission to do it, destroy my property and all kinds of stuff. They just made it very, very hard for me to stay.
In this next section, we discuss the experiences that Black Californians had during homelessness. Homelessness is not a static experience, but rather one of constant movement, instability, and insecurity. Black Californians were more likely to report staying at least one night in emergency shelters. They were similarly likely as white participants to stay in hotels or motels paid for them by themselves or their friends and family, but more likely than non-Black, non-white Californians to do so. They were less likely to sleep in vehicles than white Californians. Over 3/4, or 77% of Black participants reported sleeping outdoors, and 40% reported sleeping in a vehicle at some point in the past 6 months. Black Californians were more likely to report at least one chronic medical condition. While many Black Californians experiencing homelessness had health insurance and a regular source of health care, they experienced discrimination in healthcare settings. Black participants discussed healthcare providers ignoring or disregarding symptoms of health conditions due to assumptions rooted in anti-Blackness. As one participant shared with us,
Sometimes I feel as though I have to beg for the doctor to take care of me. You know, all I'm looking for is my painkillers, and they keep coming to me with this, "You're gonna overdose." And I keep telling them I'm not in it for the high. I don't even know what the high feels like. I know what the pain feel like without it. So I keep trying to tell them, I'll sign whatever you need me to sign. White people walk out of there with a bag full of pills and there's no problem for them. But I gotta fight tooth and nail for something I really need.
Black Californians were more likely to experience a hospitalization for a physical health concern in the prior 6 months than white Californians, 28% versus 16%. Black Californians experiencing homelessness had a higher prevalence of severe mental health symptoms during homelessness compared to other racial groups. In the prior 30 days, 18% of Black Californians experiencing homelessness reported a hallucination, as opposed to, in the prior 30 days, 8% of white, and those percent from other racial groups did so. While the experiences of homelessness caused many people to suffer mental health symptoms, homelessness also exacerbated existing mental health symptoms. As one participant shared with us,
I cry because I've been so discouraged that I don't think I'm worth living. I just go to the bridge because that's the way that I'll kill myself. Free housing creates a huge opportunity to work towards your image and your personal development. You don't have to work 3 jobs to pay rent. You don't have to have your fear and your worries. That's the basic foundation just to make you a man and give you time to land a good job that's going to provide good housing.
with that, I will turn it over to Sage to tell us more about experiences during homelessness and barriers to rehousing.
Thank you, Robynne. Black Californians reported substance use during homelessness less frequently than white Californians and those from other racial groups experiencing homelessness. 38% of Black Californians reported either current, regular, illicit drug use or heavy episodic alcohol use. 47% of white and 44% of those from other racial groups did so. Jail stays were common during the current episode of homelessness. Over a quarter of Black Californians experience one or more short-term jail stays during the current episode of homelessness. Many discuss being unfairly targeted by law enforcement because of their homelessness. Other races reported similar proportions of short-term jail stays during the current episode of homelessness. Homelessness leaves individuals at risk for experiencing violence. This was no different for Black Californians. 33% experienced physical or sexual violence during their current episode of homelessness. 32% reported experiencing physical violence. 11% reported sexual violence. Discrimination was also common. 78% of Black Californians reported experiencing discrimination in their daily lives. One in-depth interview participant highlights what this is like for him.
It's no different than when I'm homeless. Other than the fact that being homeless and Black is worse than just being homeless, I think. But it's not any discrimination that I haven't dealt with every day. You know, just if I go into a restaurant, Black, they might look at me like I'm not going to pay, but they won't make me pay for my food before they give it to me. Being homeless, they make you pay for your food before they serve it, which is like embarrassing. When you're the only people in there that's paying for your food before they bring it.
Now we will turn to the discussion of the barriers that Black Californians face when attempting to find housing. Black Californians experiencing homelessness face numerous barriers to exiting homelessness. Housing costs were a barrier to permanent housing for 82% of those Californians experiencing homelessness. Black Californians experiencing homelessness. Black Californians had extremely low household incomes in the months prior to homelessness, and their incomes decreased while unhoused. Lengthy wait lists delayed exits from homelessness. 59% of Black Californians noted that these long wait lists were a barrier to keeping them homeless. 48% of white and 49% of those from other racial groups did. In in-depth interviews, participants described years-long or closed wait lists for rental assistance and affordable housing. Despite a desire for housing, a shortage of affordable housing across California hindered their exit from homelessness. One participant shared,
I got money to put away to move in somewhere, but it's got to be affordable. And when we went there, they said it takes anywhere from 1 year to 2 years.
Black Californians experiencing homelessness described discrimination as a barrier more often than white Californians experiencing homelessness. Over half of Black Californians noted that discrimination was a barrier compared to 31% of white Californians. Black participants encountered subtle yet pervasive racial discrimination in their search for housing. They described being turned down for available housing units once the property manager or rental manager observed their racial identity. Black participants also discussed the overlapping discrimination they face for being both Black and homeless. One participant shared,
if I'm going to go into what I consider to be a decent neighborhood, sometimes the person will come out to show you the place, and they've already got me figured out. They've got me pegged. I'm Black. They say, what type of work do you do? Well, I was homeless. I'm heavily scrutinized like that. Somehow or another, it's like we got homeless on our foreheads or something, invisible.
Thank you. Black Californians were optimistic that relatively small amounts of financial support and housing navigation could help them return to permanent housing. 85% believed that a shallow monthly subsidy of $300 to $500 would have helped them exit homelessness. 96% believed a lump sum payment of $5,000 or $10,000 would have done so. 97% believed a housing voucher that limited their rental contribution would help, and 96% believed that housing navigation would help them exit homelessness. Now hand off the presentation back to Dr. Kara Young-Ponder to discuss our policy and recommendations.
Thank you, Sage. For our final section of the presentation today, we'll present policy recommendations based on our findings. To support Black Californians at risk of or experiencing homelessness, we offer recommendations that span 6 categories: address the economic marginalization of Black Americans, increase access to affordable housing options, strengthen homelessness prevention efforts, address the criminal justice system to homelessness cycle, support equitable health outcomes, and center equity in the homelessness response system. To decrease the overrepresentation of Black Americans in homeless populations, addressing the economic exclusion of Black people is crucial. We propose doing so by providing direct cash assistance via reparations and guaranteed income for extremely low-income Black Americans, increasing opportunities for workforce participation, and supporting efforts to raise the minimum wage. California is 1 million units short of affordable and available housing for extremely low-income renters, of which Black Californians are overrepresented. We need to do all we can to close this gap. We need to bolster efforts to minimize discrimination in the housing market and invest in housing navigation, which could help Black Americans identify housing in a market of scarce options and discrimination. We need to increase affordable housing productions and focus on preserving affordability of existing units to prevent these options from further dwindling. We need to bolster rental assistance, first by expanding availability. Currently, only 1 in 4 of everyone eligible for federal rental assistance receives it. Further, participants describe challenges using housing vouchers, given the difference between market rate rent in some areas and rental assistance payment standards. We must address this mismatch to support usability. Efforts to prevent homelessness can keep Black Californians stably housed, disrupting cycles between housing and homelessness. There is a need to invest in expanded eviction prevention efforts, including free legal counsel services for extremely low-income tenants and promoting tenant property owner mediation. There is a clear need to increase awareness of resources. Few Black Californians reached out for help outside of their familial and social networks to prevent their homelessness. We need to engage in affirmative outreach to Black Californians about resources available to prevent homelessness before those resources are needed. Finally, we should prevent recurrence of homelessness through targeted prevention and housing retention efforts, strengthening support for those who have experienced homelessness before or grew up or lost housing in disinvested neighborhoods is needed to prevent returns to homelessness. Black Americans are disproportionately represented in carceral populations. Criminal legal system records increase both the risk of homelessness and the difficulty for exiting homelessness. To address this, we need to strengthen reentry support available for those exiting prison and jails. Strengthening reentry support, such as connections to affordable permanent housing options, employment opportunities, healthcare services, and government benefits, could help reduce both inflows into homelessness and returns to carceral settings. To stem cycles between incarceration and homelessness, approaches to address homelessness in public spaces should prioritize connections to housing and minimize law enforcement involvement. There is a critical need to lower barriers to housing and employment for those with criminal justice records, addressing discrimination they face, and expand clean slate laws, which allow for clearance of arrest and conviction records after a period of time. Finally, we need to strengthen support efforts in transitional housing and ensure that connections to permanent housing are made. Those who enter homelessness from extended jail and prison stays discussed how the transitional housing after release did not last long enough for them to obtain employment and housing post-release, which led to their becoming homeless. Black Californians experiencing homelessness are in poor health. Despite some being connected to healthcare systems, many face barriers to accessing equitable, trauma-informed healthcare services. We need to address biases in healthcare systems through evidence-based training for healthcare workers, increasing the availability of racially concordant care, which refers to alignment between the racial identity of a patient and their healthcare provider, and expanding use of peer health promotion models. To support Black Californians with behavioral health needs, there's a need to increase the availability of permanent supportive housing with robust and insured models of care to meet their needs. Finally, there is a critical need to strengthen connections between housing and healthcare systems. Housing is a social determinant of health. Healthcare systems can recognize this intersection by strengthening housing adjacent programs and services. Black Californians experiencing homelessness have experienced multiple forms of trauma across their life course. Responses to homelessness should be trauma-informed, intentional about decreasing racial disparities, and include the voices of those impacted by homelessness in the Black community. To accomplish this, we need systems-level shifts. Coordinated entry serves as the primary access point to homelessness services for those who are at risk of or currently experiencing homelessness. There is a need to improve assessment tools used by coordinated entry and ensure the system is responsive to the needs of parents separated from their children. Black leaders should be at the helm of addressing this crisis. Further investment in increasing Black leadership in homeless service systems and creating pathways for meaningful engagement with Black Californians with lived experiences of homelessness are critical to ensuring that. And with that, I'll pass it back over to Dr. Tiana Moore, who will lead us through the Q&A.
Thank you so much, Kara. And thank you to all of our panelists for such a very informative session. I'd like to invite all of our panelists to turn their cameras on now. We have some really fantastic questions that are emerging in the chat, and we'll get to answer as many of them as we can. But my very first question is for both Robynne and Sage. What changes in policy or current practices would you want to see come from this research to help Black Californians experiencing homelessness? And we'll start with Robynne.
Thank you, Tiana. Based on the research, it should be noted that there's a need for additional professional development for the workforce in the homeless services sector. It should be a priority for organizations to identify evidence-based research and put together a curriculum to increase workers' skills around racial equity and diversity, equity and inclusion for folks who work with people who are experiencing homelessness. The need to have a better understanding of the historical inequities Black Californians have experienced and the systemic inequalities to create a more equitable practice to have positive outcomes. Additionally, the research supports that we must honor the time and personal stories of people. Historic systemic racism has diminished Black Californians' trust. So when community outreach workers go out into the field and meet with people who are experiencing homelessness, they should have viable, available resources to assist with remediating the barriers to entry Black Californians who are experiencing homelessness face. The long-term arrangement of outreach requires trust. Going out and talking with someone should be for the purpose of developing a relationship with them. Once that trust is established, there can be a positive outcome from that relationship, whether it's access to treatment for a physical or mental condition or accessing housing services. If community workers are just going out into the field to meet folks and they do not have any tangible or helpful resources, it's a breach of trust. It's a waste of people's time, and it's basically surveillance. To support the relationship and to safely move people into a place to utilize the system, there must be resource provision. It's a proving ground for growth and access. My last policy recommendation is figuring out affordable housing. It's true, there are many, many entities in the field who are trying to tackle this issue. However, it's crucial to rectify because if every single person who is experiencing homelessness in California suddenly had the financial resources to obtain housing, there would not be enough places for people to live. And that's truly a problem in the field. It ties to the aforementioned issue of community workers and outreach. If the system of providers cannot accomplish the goal they're outreaching for, they want people to come off the riverbed or off of street corners, they have to have some place for them to go. The data suggests that not everybody is comfortable in a shelter, but they do very much want to be housed. Black Californians' challenges in obtaining housing are well documented. Redlining, unfair rental practices, the system has been broken for very long. We haven't done enough at the end of the pipeline to ensure that there's housing for everyone. So that's my last recommendation, to identify locations, reduce the red tape, fund and build more affordable housing.
Thank you so much for that, Robynne. Sage, same question for you.
Thank you, and excellent points, Robynne. I would like to see the continuing evolution of equitable practices assisting Black Californians experiencing homelessness. I would like to see an enhanced streamlining process of people being welcomed at access centers. Access centers being where people are able to be met with case management and referrals to various services. In addition to an individual's primary needs with housing, there are other immediate needs that may need to be addressed at the time, such as access to food pantries, signing up for public benefits assistance, workforce training and development, support groups, and daycare services can be brought up at that time as well. Culturally competent case management rooted in trauma-informed care and harm reduction is especially important when priorities are being sorted out to lessen the negative effects of someone's crisis. Next, I'd like to emphasize prevention and diversion. Prevention is an intervention which assists with seeking alternative resources, primarily financial means, to keep a resident stably housed without risking eviction or housing insecurity. Diversion is an intervention designed to immediately address the needs of someone who has just lost their housing. Diversion is used to circumvent someone entering into the shelter and unsheltered homeless system and find alternative housing placements, such as being placed with a family member or other designated support person. Diversion is also to keep someone's homelessness experience as brief as possible. We should continue allocating funds to keep people housed when encountering a financial crisis. This could be dispersed as a one-time payment, a short-term monthly subsidy, or referrals to affordable housing. This is especially beneficial with keeping families and children together. Lastly, let's continue to address the health needs of Black Californians. This includes advertisement and access, and I want to emphasize advertisement of these resources to healthy and nutritious foods, access to routine medical care and medicine, transportation assistance, and support groups for those affected by mainstream systems such as the incarceration system, for those who are current or former foster youth, people experiencing intimate partner violence, for our survivors of human trafficking, for our veterans, and for those identifying as lesbian, gay, bisexual, transgender, and queer, to name a few populations that would benefit from support groups. Thank you.
Thank you so much for that, Sage. My next question is for Kara. To what extent do you think these results are generalizable beyond California?
Thank you so much for that question. We believe that these results are generalizable across the country for a couple of reasons. First, 28% of all people experiencing homelessness live in California. 50% of all people who are experiencing unsheltered homelessness live in California. We know that racial disparities, in particular, the overrepresentation of Black Americans in the homeless population, is true across the nation. We also want to note that the CASPEH was done to represent the diversity of California. We did interviews in urban, rural, suburban, inland, coastal communities. And we did that because we know that from one part of California to the next, populations are very different, but taken as a whole, California does share quite a bit of overlap with demographic trends and other trends in healthcare and education and carceral systems as the rest of the country. So yes, we do believe that this is generalizable.
Thank you so much for that, Kara. We have a question in the chat around thinking about supporting folks who are from the LGBTQ community. So thinking about, I guess the question is, can you share insights from LGBTQ participants or just generally those who are Black and also identify as LGBTQ, who find themselves at odds with family over religious beliefs, leading to them experiencing homelessness, specifically amongst Black Tay youth? Sage, I actually think this is a perfect question given the work that you do to respond to.
Thank you. Shout out to working as case management and peer support for years. I like to start off with, for those who don't know, TAY stands for Transitional Age Youth. Transitional Age Youth are for young adults, specifically 18 to 24 years old, CASPEH 25 years old. The reason why TAY is separate from the general homeless population of those 18 and over is because young adults lack the social and financial support and are a very unique population when first encountering housing insecurity. So they need special services in order to help them build up those supports to get through this crisis. It's not as if they've had many years of work history. It's not as if they have so many years of college experience. It's just more so as someone who is newly an adult and who is going through a crisis, we have these services to assist them more. It's more hands-on, it's more holistic, which I've seen in the change in tide for the last 9 years, and it's definitely better, it's better tailored for young people. So I do want to say that. And the question in regards to young Black queer adults, I would say for those who have been kicked out of their house for their gender or sexual orientation, it wasn't always for religious purposes. It was for the fact that their parents or whoever they were staying with wasn't able to accept who they were. So then they were asked to leave. And that's when the necessity of community comes in, because community will assist where one person fails. No disrespect to the parents, but when the household fails, is a necessity for someone else in the community to uphold that young person, to potentially let them stay on their couch, for their friends to be able to, I don't know, maybe piece together to become roommates for an apartment, a studio, one bedroom, or what have you. Anything that may be an opportunity or possibility before actually entering into the homeless system, because although we have a smaller number of LGBTQ participants who are unhoused in shelters, there's still an overrepresentation because of them being exited out of their home due to their identity. Thank you.
Thank you so much for that, Sage. Before tossing the question to the next panelist, I do want to address a question that came up in the chat around coordinated entry and what prioritization looks like and how that can drive some racial disparities. So I think the specific question was, do we have recommendations for that? So there are a couple. I think one of the more striking findings that we have is that even though 6% of Black Californians experiencing homelessness were classified as adults and families by systems, what we found is that 27% of folks who were classified as single adults or transition age youth actually had minor children living with them. So they're not seen or read as adults in homeless families, even though they do have children living with them. And so we need to think about ways for coordinated entry to actually account for this in their prioritization schemes. I think a more common or a more commonly known issue with coordinated entry is the fact that oftentimes Black individuals, I should say, are deprioritized in some of the assessment tools that we have at hand in coordinated entry. And so making sure that we actually are intentional about the design of assessments, that we aren't unintentionally driving disparities by thinking about prioritization schemes is also very, very important to consider. And with that, I'll also pass another question over to, Sage would like to address it as well. Thank you.
Thank you. Regarding the coordinated entry system, another reason why there is an underrepresentation in the accuracy of people's livelihoods and everything that kind of builds up their needs and priority within the coordinated entry system is because for whoever is facilitating that assessment may not be the best person to facilitate that assessment to an individual. I used to give the coordinated entry system assessments, particularly to young adults, and compare it to my non-Black co-workers. We did see that Black clients were able to actually have more accurate scope of what their needs were because they felt more comfortable relating to someone, where you may have someone who is non-Black facilitating the assessment. They're going to interpret someone else's livelihood in difference to what the assessment is actually asking for. So I'm sorry that may not have came out as articulate as it was, but definitely it depends on who is facilitating the coordinated entry system to get as accurate of a crisis as someone experiencing as possible. So that is something that I've seen before. Thank you.
Thank you, Sage. Kara, do you have something that you wanted to add to this as well?
Yeah, just wanted to say that, the way that anti-Black racism works is a lot of it is explicit, right? It's explicit. People say it out loud and they mean it, but a lot of it is implicit, meaning that it's happening on a subconscious level and people aren't necessarily aware of the ways in which they're duplicating these racial hierarchies that end in Black people having less privilege and power and prestige and housing and resources than others. And so with all of our recommendations, none of them work unless we reduce the incidence of racism overall. And so thinking about coordinated entry, yes, it is about prioritizing Black folks and making sure that people can have accurate scores. And I think before we can even get there, right, some of the other policy recommendations we had, for example, was about training, that we need more rigorous training for the people who are service providers and researchers and people across the board, policymakers, to continue to dive deep into how anti-Black racism is being reproduced inside of their organizations, because without it, we can almost definitely guarantee that anti-Black racism will continue to flourish and, for example, deprioritize Black people for housing and services, even if that's not the intent of the programs and the policies in place.
I have a brief comment. We've been in conversations with a number of communities who are considering where to go next in prioritization. A lot of communities are in that particular space, and it's worth starting from the beginning and examining the different values you have when you're thinking about who to prioritize and why. To me, that's a foundational question that could get you to some better places. And also, as Sage was pointing out, the methodology, how you get there. I think so many people are so used to a battery of questions helping to make decisions, but there are other approaches that we could take in deciding who should get services.
Thank you for that, Joy. And my next question is actually for you as well, Joy. We have a question in the chat around how do we recommend, or how do we actually advocate for some of these policy changes? Do you have any recommendations for someone who wants to actually on the ground be an advocate for these policy changes regarding Black Californians or Black Americans?
Sure, I think it's good to become connected with organizations and groups that are regularly developing policy proposals, thinking through solutions and engaged in grassroots efforts. I can say that my group is one of them, the National Alliance to End Homelessness. We do have a grassroots network where we let people know about things that are happening in Congress and opportunities to call your member of Congress, email and let them know what you support and what you don't. And there are others as well. I'm sure other folks on the panel would be better able to speak to California specific networks, but definitely, join a list, follow what's happening and be prepared to add your voice in those very basic ways, but there might be some other opportunities to physically go someplace and protest or write letters to the editor, et cetera. If you're interested, we'll find, and others will find ways to help you figure out how to jump in.
Thanks for that, Joy. Robynne, do you have anything you'd like to add to that one as well?
Absolutely. Joy is always a font of great knowledge, and I echo all of those suggestions and want to amplify some of the learnings that we benefited from during COVID, and that is the mixed methodology of interaction with your legislators. So there's lots of opportunities now to not have to be in person, but to advocate, including Zoom watching of hearings and the ability to send in your comments via email to legislative staff and stakeholders. And I think it's really important because it isn't just people who show up in an office that are having an impact. As an organization, a community organization, you could do a letter writing campaign. Letters have a huge impact in how decisions are being made because it's how communities, particularly communities of color, can be heard. And it also is a good way for digitally, I mean, it's a good way for you to track bills and other kind of legislation that's making its way through the process. And that way you don't necessarily have to be on the Hill or at the Capitol in order to keep your hand in and understand what's going on. And the last way is find the thing that you're passionate about and then contribute. Make sure that you are not only voting with your letter writing skills, but also contribute available dollars to those people and organizations that are doing the work that you'd like to see done.
Thank you, Robynne. We have a couple of questions about initiatives and efforts and programs that are designed to either prevent homelessness among Black Californians or support housing retention. And wondering, Sage, Joy, Robynne, and Kara, if you guys have any thoughts on what those programs might be, and if not thoughts on specific ones, what would those programs be composed of if they were to be successful? And I can get us kicked off. I think one of the things that comes immediately to mind when thinking about kind of efforts to keep folks housed is the need to make sure that the housing that we are ensuring that people are transferring to is permanently affordable. So making sure that people are connected to rental subsidies, making sure that we do all that we can to make sure that housing costs aren't a barrier for folks in terms of keeping up rent. And I wonder if there are any initiatives that you all are working on that are a little bit more specific to the areas that you are in that tackle the same issues.
I just want to echo and amplify the work of the CASPEH and the discussion around shallow subsidies and other sorts of financial assistance that were highlighted in the report. Most of the participants in the study indicated that even a small subsidy would have made a difference in their falling into homelessness. And there are plenty of initiatives around the country that are reflective of that shallow subsidy, whether it be guaranteed income or other types of workforce development programs. And so understanding the value and importance of those subsidies and how they play a huge role in people staying housed. And again, highlight the data around families. Many families are falling apart due to homelessness. And so it is another way for us to strengthen and support families by ensuring that they have the resources they need to stay housed.
Thank you for that, Robynne. I think we are actually at time, unfortunately. I do want to just thank everyone for their time and answers and insight today. The report on Black Californians' experiences of homelessness is available on our website. Again, a huge thank you to our panelists today and all of you for joining us. Please enjoy the rest of your day.